一唔翻嚟仲大件事，要錫住佢。好。
Sorry, Secretary. We have just had a short break at about 4:45. I need to register at another panel meeting. It would take 3 to 4 minutes. Let's continue with our questions. Mr. Alan Leung. Well, I haven't actually reached Chapter 3. I have some questions in respect of Chapter 2. This morning we spent quite some time in a discussion of 2.41, the number of places. I forgot to ask this question this morning. In June 2005, there was an assignment review of the ICAC. The ICAC expressed concern about the risk in the admission procedure for the AQ places, particularly the concerns about possible abuse in making priority placement and manipulation of the waiting lists. And the director brushed it aside in a casual way, saying that ICAC would from time to time conduct assignment reviews. So my question for the Director of Audit is this. Did you look into the ICAC review report in 2005 in your audit review? Were you aware of the recommendations made by the ICAC? And also in paragraph 2.42, in June 2006, the SWD issued guidelines following the ICAC assignment review to NGOs with AQ places. Were those guidelines looked into by the Director of Audit in his review? I'll ask my deputy to respond to this question. Thank you, Chairman. I'm speaking from memory. Maybe the SWK can also supplement. In 2005, the director back then was Mrs. Carrie Lam. The review was conducted at her request. We did look into the report. The concern was that under this AQ places system, there may be possible abuse in making priority placement and manipulation of the waiting list. And after the review in 2006, the SWD issued 7 or 8 pages of guidelines to NGOs and asked them to follow the new guidelines. There was no need for operation manuals to be submitted, but they have to fill in a self-assessment annual report form for compliance purposes, something like this thick. Can we be given the 2 documents? I don't know whether it's proper, or should we ask the SWD? I think it's more proper to ask the SWD to give you the documents. Okay. So can I put it this way, put it like this, and I'll give the opportunity to the director to respond. In 2005, 2006, the ICAC did have this view, and that is the AQ places might give rise to certain risk of abuse in making priority placements. And since 2006, well, we're talking about a span of 8 years. So can I put it like this? In the 8 years, the government, especially the SWD, did not handle or take on board the ICAC recommendations seriously, and the guidelines issued did not achieve the desired effect. That's why we have the criticism this time from the Director of Audit concerning the possible abuse of unfair placements. It's in paragraph 2.46. That's the observation of the Audit Commission. Can we make this conclusion? 8 years ago, there was this reminder, and subsequently we have had a case of dereliction of duty. Well, this is not yet our conclusion, but I would think that we need to get some response from the director. Director, you know what the member is asking for? Yes. According to the audit report, back then there was a review conducted at the request of the SWD back then, and there were regular reviews on other operational matters. The purpose of the review was not to take back the places for those NGOs, but rather to make sure that the places are allocated fairly and transparently. So when the NGOs manage the waiting list, we wanted to know the processing and who should be given priority placement, and whether the elderly applicants should be subject to a centralized assessment procedure. As said, there were guidelines issued subsequent to the review. Under the guidelines, the NGOs were required to submit annual returns to the SWD, setting out the number of applications received and which applications have been accepted, and also the general situation surrounding the waiting time. In some NGOs, the waiting time was rather long, in some cases longer than that of the central waiting list. But the ICAC review was conducted not for the purpose of taking back the AQ places, but to make sure that the places were allocated fairly, justly, and transparently. And for that particular purpose, it was actually achieved. Mr. Alan Leung, so 8 years ago, ICAC conducted an assignment review, and I can say that at that time, SWD focused in its attention on these AQ places of NGOs. And now it's 8 years afterwards, and still the Director of Audit has to come to this finding, and that is it may lead to unfair allocation of AQ places. So maybe the SWD did not work hard enough to take away these AQ places from the NGOs. I think if the director has anything to add, it's most welcome. Otherwise, there's no need to repeat previous comments. In 2.46, the Audit Commission refers to certain unfair situation, and that is there are people who have recently joined the queue may have to be put on the central waiting list as well. The ICAC review was about fair allocation of the AQ places. But the Audit Commission was not about whether the ICAC recommendations were follow up, but rather whether allowing these applications to be processed under the AQ system might be unfair to those still on the central waiting list. Such AQ places would still be there in the future. We may have to consider ways to allow such places to be made available also to those on the central waiting list. Director, the issue is unfairness. In Note 34, it said that it's on a first-come, first-served basis if we are talking about the central waiting list. I think this paragraph is about that spirit of fairness. I think Note 34 is clear about this. And according to the report, for the past 8 years, you did not really live up to that guidelines of yours. You did not properly monitor the system. So your explanation doesn't seem right to me. Maybe I have misunderstood something here? Or maybe I haven't made myself clear. I'm talking about the two situations of two unfair situations. With regard to the unfairness identified by the ICAC, we issue guidelines and the issues were asked to comply. And here we're talking about the allocations of by NGOs and RCHEs and how it should be managed fairly. So we need to take a look. We need to read the ICAC report before we know how to write our report. I think the director would agree that the best way to ensure fairness is that all such NGOs or RCHEs would have all their places made available for the applicants on the central waiting list. That would be the fairest way of going about it. In our report, we may have to focus on what happened in the past 8 years. The director may wish to consider giving us a report in writings, telling us what you have been doing since 8 years ago. You have been taking back more than 1,000 places. Maybe you can set out the different measures that you have taken in chronological order. That would be most helpful. Let me now turn to 2.45 of the 2.54 of the report. Again, this is another focal point of the audit report. This is about the nursing homes. The nursing homes are not the subject of an audit report for the first time. Actually, back in the audit report in 2001 and 2002, there was another one on nursing homes, and there were some recommendations because the expenditure level of nursing homes is on the high side because the residents require intensive medical care, and the report was issued 12 years ago. In that audit report, it was said that if there were places not taken up by elderly residents, maybe they should be turned into the RCHE's places. That's in audit report number 38. And now the problem is still with us, some 10 odd years. According to 2.54, as mentioned earlier, there were only there were 62 or 11% of 580 RU places which had been vacant for at least 5 years. We're talking about an annual cost of $80,000 per place. If you have 62 RU places left vacant for 5 years, that's quite a big sum. That's just a repeat of the mistake identified in audit report number 38. So is it that we failed or you failed to address the problems in the 10 odd years concerned? Director, do you know what we are asking about? Yes, we know it's a shortcoming, and we need to do a much better job in consolidating our efforts. We provide infirmary unit places because when the level of care is such that the elderly resident is frail but does not require immediate hospitalization. So these places we are provided. We're talking about 20 places counting as one unit because we need to provide the necessary staff supplement. So we can have one registered nurse and 4 enrolled nurses. For bigger homes, we may have 20 plus 20 RU places, so that they will be served by 2 the registered nurses and 8 enrolled nurses. There have been cases where some places, RU places, are left vacant. Some of the residents were admitted to the nursing homes in the medical sector. And since 1996, in many homes, we have had cases of deteriorating health of residents. So we provide a subsidy, a grant, to enhance the manpower supplement. There will be a need to consolidate the 2 services. We'd like to make use of the RU places first because they're already there, and we should not waste such resources. So we would buy these places first. Once these places are filled, then we would consider the granting of a subsidy later to enhance support. We would like to see some consolidation in the utilization of the 2 sets of resources.
We
have already started work. After the report number 38, we identified a problem. Perhaps we missed it before. In report number 38, can you tell us what you did and why it happened? The director mentioned some improvement measures, and in 2004, if RCHEs have elderly people to be nursed, they can apply for the grants. and the elderly people will be notified of any vacancies in RCHEs, and they were invited to consider these RCHEs first. And if these RCHEs were full, then a nursing grants will be disseminated. Later on, we can share with the members how many elderly people used these nursing places and how many received a nursing grants. So this is a dual approach. Mr. Leung asked whether you will convert these RCHEs to nursing homes. The extent is different. We're talking about two different things. One is nursing level, one is an infirm level, which is worse off from a health point of view. They would require more intensive support. So we cannot just assign them to caring homes of a lesser caring level. And the waiting list for less intensive care homes is already very long. For nursing homes, since a lot of the places are left vacant, instead of continue to pumping in money, why don't you allocate them to elderly people who require less intensive care, so that the waiting list can be shorter? And as the deputy director said, this was launched in November. And the nursing home grants, you might be able to save a lot on the nursing home grants. If you can save money here, can the money be allocated to nursing homes instead? So would you set a time frame for review to see if you can free up any resources to buy more places at private care homes or build new nursing homes in order to make the waiting list shorter? Do you have any plans? Chairman, as the deputy director said, the program started in November, so we need some time and to assess the level of care required, to see the level of need for IU places. And half a year later, when we have the statistics, we will review the resources we have. If we have spare resources, we will invest them back onto our RCHE places. And maybe the director can look at past statistics. Since report number 38 was out, up until now, I'm very sure that the chief secretary at that time was only going through the motions, and he said he would follow up. So what has been done in the past 12 years? Can you let us know the relevant papers for reference? I was here when report number 38 was published. Well, because you're the most experienced. No, because I'm very old. When I look at report number 38, the infirmary care services, they were referring to infirmary care in hospitals, and the level of service and facilities required were much higher. But when we talk about RCHEs, we want to help elderly people who need considerable help. And these elderly people are already in care homes, and as such, we would introduce IU or infirmary units in these RCHEs in order to help these elderly people. Can we help them in a non-hospital setting? we are talking about separate queues here, waiting lists here. And when I look at the extract of report number 38, the Audit Commission, if the resources invested in the 1134 house places were put elsewhere to help elderly people with less and intensive care levels, more than $10 million could be saved, and the money can be put aside to introduce more than 900 IU places. Yeah, I'm sure the director would agree with the logic of such proposal, and it's the same. The logic is the same as the current care places offered. I'm sure the director would understand the situation very well. So if you have any statistics, please submit it to the members before we come up with our reports. No problem. Please bear in mind that we are not asking you to reduce the care places, but instead of leaving the places vacant, the point is to make better use of the resources. Please don't leave places unused while some people are waiting. So please don't get us wrong, because sometimes we are being misunderstood. So don't stigmatize us. We hope that elderly people who need infirmary services can get what they need, and at the same time, we don't want to see a lot of vacant places in infirmaries. I just want to echo with the observations of the chairman in 2.55 in page 41. The Audit Commission noted that as of end August 2014, some 1,290 applicants awaiting RCS places on the central waiting list had been assessed as in need of care at Beyond Nursing Home. These people should receive infirmary care or hospital care, or receive an infirmary grant in hospitals. But according to the audit, 580 IU places, 11% of the 580 IU places were continuously unoccupied. And while these 1,290 applicants were assessed as in need of care at beyond NH level, and apparently they are not being taken care of. So this is something we are very concerned about. And as the chairman said, we are not asking you to cancel the infirmary grants, or else these 1,290 elderly people would suffer even more. But since you are doing very well with IUs and but by common logic, we are suggesting you to invest the money on the 30,000 elderly people on the waiting list instead. But please bear in mind that the PAC is not asking you to revoke the infirmary grants. I want to know why there are 1,290 applicants in this situation, while some places are left vacant. How can you improve on the situation? Chairman, the question was very clear. we understand that the committee is not asking us to cut the number of places, and this is our main approach before securing an infirmary grant. If IU places were available, we would recommend them to take them up first, and we will enhance our RCHE services. And for those 1,290 applicants on the central waiting list who are waiting for care beyond NH level, they are lining up for nursing homes at the same time. And we have introduced a new measure with nursing homes. After they are admitted, they can receive constant care. At infirmaries and nursing homes, we would enhance resources. We would introduce more resources, as the Secretary mentioned. And after being admitted, if an elderly person gets worse in terms of health, he might be reluctant to move to another RCHE because he might have gotten use of the staff and carers. So after being admitted to a nursing home, if an elderly person deteriorates health-wise, with the additional resources, we are hoping to provide constant care. So we are adopting a multi-pronged approach. I have one last question for this part. In paragraph 2.58, the director mentioned that the average infirmary grants every year is $70,539 in order to provide infirmary care for the elderly. But having looked at 2.58, the audit found that all 19 RCHEs with IUs had not been registered with the Department of Health, which regulates the infirmary care services under the Hospitals, Nursing Homes and Maternity Homes Registration Ordinance. So this is rather worrying. Did they fail to obtain the registration because of the lack of service standards or manpower? So I'd like to know more. You have paid $70,539 to these nursing homes in order to provide deeper or more intensive care for our elderly, equivalent to the level of care afforded by infirmaries. But yet, all 19 RCHEs failed to obtain the registration. What was the reason? Chairman, we are talking about two types of infirmary services. For a proper infirmary, when they admit elderly people, their health conditions require infirmary services. Their health is relatively bad, and by law, the infirmaries must be registered. What I mentioned was constant care services. When the elderly people are admitted to RCHEs, at the beginning, they might not require a lot of help, but with age, their health deteriorates. We are hoping to provide constant care for these people. So in nursing homes, we want to introduce infirmary units. It doesn't mean that we are converting nursing homes to infirmaries. These institutions cannot admit elderly people who already require a high level of health. We are trying to help elderly people who would like to remain at the same nursing homes while receiving more intensive services. So we are going to introduce extra staff. So there is a difference between the two. So in the nursing homes, we will introduce IUs in order to take care of elderly people who are already there. But in terms of manpower deployment, we might need to introduce more staff. This is a constant scheme. Ellen, does it mean that it's expected that they could not obtain the registration because they are not supposed to be infirmaries. But you would pay $70,539 to purchase equipment, infirmary equipment, or recruit more people to operate these equipment. So that's my understanding. Would you consider the issue from the standpoint of the elderly people? Without the registration, perhaps they can only receive substandard services. But my impression is that no, right? The answer is no. They were not expected to secure the registration because they are not infirmaries, and the standard of the intensive care received by the elderly people would not be compromised. Is that the correct understanding? Yes. So that's all I want to ask for now. Mr. Raymond Wong has questions for Part 3. Ellen would like to ask more about the infirmaries. I've just rejoined the meeting, so I might what I raised might be might have been mentioned already, but I want to talk about paragraph 2.60 about the scheme. I don't know if this has been discussed earlier. No. Under 2.60, there is a trial scheme to provide subsidized infirmary care services for medically stable frail elderly in RCHE premises. But as far as I know, this scheme is kept on hold. So what is the latest progress? Director, it started in 2004, right? Yes, in December 2004, the SWD reported the scheme to LegCo, and at that time they proposed a trial scheme to provide infirmary care services for the elderly in non-hospital settings. It's similar. The services are similar to an infirmary, and the target is elderly people who require infirmary services. But services in hospitals are very expensive, so we were looking to provide the services in a non-hospital setting, and we consulted the Legislative Council, and members had different comments and concerns, and some members were concerned that these elderly people were already frail, and in a non-hospital setting, they require infirmary services. How do we better provide healthcare services for them, and how do we connect these services with other types of services? And we heard various comments, and our decision was to upgrade existing nursing homes to provide infirmary services. So that's the IU, or infirmary units, we mentioned. And it would be the more efficient approach. So that's why we shelved this scheme.
Theoretically, there should have been a report to this council. Why there has been none? Well, we can provide the details, and we can report to the council. We have not given it up. 10 years, right? We need to find a site. In fact, we have not given up. We still want to try. With aging population, whether it's infirmary care, nursing care, RCHE, the service cannot catch up with aging population. And we are looking into that, and we can report to the council. Yes, provide a paper to the council and let them follow up. Yes, Paul. Well, concerning paragraph 2.54, some RCHEs has been vacant for 5 years. The question has been answered, but you can still ask the question from another perspective. I mean, some IUs have been vacant for several years. Now there will be another meeting at 4:30. You can ask your question. At about 4:40, I will give 10 minutes to members. I believe the questions have been asked. We will have a break for 10 minutes, and we'll move next doors and register ourselves. That is a Bills Committee on Copyright, and there is also the Education panel.